Hi, welcome back. We're gonna keep going with cardio. Um, right now we're gonna focus on cardiomyopathy. I'm not saying it this time. All right, so we have cardiomyopathy. What is cardiomyopathy? If I can get it to go to the next thing. So cardiomyopathy is disease of the heart muscle leading to cardiac dysfunction. Classifications include dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, are ARVCD, unclassified myopathy, cardiomyopathy, and ischemic cardiomyopathy. This is often due to coronary artery disease and presents as an enlarged heart with heart failure. So I'm going to have you read about the other ones, but I'm going to focus on dilated cardiomyopathy, hypertrophic, and restrictive cardiomyopathy for this lecture, because that's what you'll be tested on. So classification system is done by AHA in 2006. We have primary cardiomyopathies, which are genetic, non-genetic, and acquired, primarily affect the heart muscle. And then secondary cardiomyopathies. So this is that myocardial involvement due to other diseases. So amyloidosis, Fabry disease, and sarcoidosis. So, with the pathophysiology, we have impaired cardiac output leads to decreased stroke volume, increased sympathetic nervous system activity, activation of renin, angiotensin, aldosterone system, increased systemic vascular resistance, sodium and fluid retention, increasing heart workload. That's all going to result in heart failure, observable as decreased ejection fraction on echocardiogram. So our discharge checklist after a valve replacement is that we understand the procedure, complications, and changes in daily living, identify recovery interventions and ongoing therapeutic regime, knowledge of medications, importance of anticoagulants and their proper use, and recognize signs of complications and when to seek help. Engage in preventative activities for conditions like infective endocarditis, and utilize community support resources effectively. Our key concept here is sodium's role. Okay. So, major electrolyte involved in cardiomyopathy, fluid overload is often linked to high sodium intake. So, what do you think you're going to educate your patient on? You're going to educate your patient on low sodium intake. So, let's talk dilated cardiomyopathy. Most common cardiomyopathy is dilated cardiomyopathy. Prevalence is 1 in 250 and 1 in 2,500. It's characterized by significant dilation of ventricles without hypertrophy, systolic dysfunction with decreased ejection fraction. There are microscopic changes, so we'll have that diminished contractile elements, actin and myosin, diffuse necrosis of myocardial cells, and this will result in poor systolic function, increased and diastolic pressure, potential for thrombi formation in the heart. Causes include there are over 75 conditions, including pregnancy, hypertension, alcohol intake, viral infections, certain medications, thyrotoxicosis, mixed edema, tachycardia, Chagas disease. So for idiopathic DCM, it'll be diagnosed with no causative factors identified, so 20 to 30% of non-ischemic cases. And familial DCM accounts for 30 to 50% of cases. 40% may have a genetic cause. This is why it's super important that we get that family history. It's critical for assessment and early diagnosis to prevent severe symptoms and sudden death. Let's move to hypertrophic cardiomyopathy, that HCM. HCM, the prevalence is estimated at 0.16% and 0.29% of the adult population. There's a genetic bias, so that autosomal dominant disorder leading to increased heart muscle size, especially affecting the septum. So, age dependency. Phenotypic expression varies with age, often manifests between adolescence and the fifth decade of life. And the risk here is leading cause of death in adolescents and young adults, particularly athletes. Diagnostic tools here are going to be the 12 lead EKGs, physical examinations, and echocardiograms. We can do genetic testing, so that would be recommended for suspected cases. Positive results indicate testing for first degree relatives. Asymptomatic individuals with positive tests should have annual screenings. The pathophysiology here is the cell structure. It would be hypertrophied cardiac muscle cells become disorganized, affecting contraction efficiency. Coronary arteries are those thickened walls that reduce blood flow, leading to ischemia and necrosis in heart tissue. And then we have the ventricular function. So we'll have that increased muscle thickness, which will reduce the ventricular cavity size and impairs relaxation, complicating diastolic filling. So then we have left ventricular outflow tract obstruction. So the mechanism here is systolic anterior motion of the mitral valve can obstruct the LVOT, especially during systole. A third have LVOT obstruction at rest. One third of patients do not have obstruction at rest, but they may have provocation, so exercise. And then a third of patients have no obstruction, even with provocation. So symptoms include syncope, dyspnea, ventricular arrhythmias, heart failure. Management's going to be hydration, beta blockers, calcium channel blockers, lifestyle modifications. And if we need surgery, it's that myectomy or alcohol septal ablation for refractory cases. Let's move on to restrictive cardiomyopathy, that RCM. So prevalence is least common type of cardiomyopathy. Um, Characteristics include diastolic dysfunction due to rigid ventricular walls, impairing filling and stretching, similar to constrictive pericarditis. The pathophysiology here is we're going to change the chamber size. So it's usually normal. Um, um, Systolic function is preserved. Okay, so and the restrictive, the chamber size stays the same, but the pressure changes. So we'll have that rapid rise in filling pressures with small increases in blood volume. And the causes for this are infiltrative diseases like amyloidosis, um, inherited storage diseases, so the hemochromatosis, non-infiltrative diseases, scleroderma, endomyocardial damage, so cancer treatments. And that is it. You made it through another quick lecture. Um, Great job. I'll see you in the next one.